Jack says, it used to be easy for me to make conversations and let others feel comfortable around me. After developing OCD and anxiety, it's been the complete opposite. I don't know how to fix that. Well, Jack, I would first of all say, go back to doing what you used to do when you weren't anxious about everything and start reinstituting all of that behavior. The feelings that you're having about that are real. I'm not going to deny that you feel them, but just because they are real doesn't mean that they're a good barometer of what's actually happening in any given situation. So what I mean by that is you're assuming that others are not comfortable around you, and you're assuming that it's not easy for you to make conversation. I don't think you've lost the ability to make conversation. I think what you've done is you've challenged yourself in your ability to judge if you're doing that. But I don't think you've lost the ability to do it. There's been a layer added in there, a window that we look through that is really cloudy and foggy that tells us, doesn't seem the same that it used to be. Therefore, we assume the worst. It must be bad. Again, no one shows up to my office and says, I'm really afraid everybody loves me and thinks I'm great, right? I've treated absolutely nobody for that. It's always the worst case scenario kind of stuff going on. So, Jack, what I want you to do is just go out and have conversations and be around people. And even though it doesn't feel the way that maybe it used to, I think it can come back if you allow yourself to do it and if you allow yourself to practice. But if you keep waiting for it to feel the way that it did, that's never going to happen without doing something to make it happen, right? As Neil Peart once wrote in one of his books about a piece of graffiti he saw in a bathroom stall one time, don't wait around for spontaneous combustion. Sometimes we have to set ourselves on fire, right? And I love that phrase, though I don't want anyone actually setting themselves on fire. It's a figurative phrase, but hopefully we all get the point here. We can hope we're not going to feel uncomfortable and then go do things, or we can be uncomfortable and do things and learn that we can handle them and then no longer be uncomfortable about them. I say go that route. That's what's going to get you to where you want to be. If you're looking for help for OCD or related conditions, check us out at NOCD.com.